Thank you for joining us for AFMRD's 2015 Year in Review. I am proud to share with you what we have done and the people who have made this year a successful one. Our organization has been helping program directors train the best and brightest family docs for over 25 years. Our mission: to inspire and empower program directors to achieve excellence. Let's see how we've done. Our executive director, Vicki Greenwood, has done a spectacular job. She transitioned smoothly from one role with the association to another. She maintains a great relationship with members and with key leaders across the family of family medicine. Her role in NIPID and in building coalitions with the ACOFP are some of the highlights in her first year as executive director. She is truly dedicated to our specialty and to AFMRD. With regards to staff, we would like to introduce Chris Pyle, your new Chief Administrative Officer. Chris comes to us from the world of public education and has grown into his role well. He has been a great addition to the team, which includes Katie Yaksa, Sam Penner, Lynn Pickerel, and Susan Quigg. We have some of the best staff you will find anywhere. They are the unsung heroes of this organization and should get the lion's share of the credit for what we have accomplished. Next, we have your board, which includes yours truly, Lisa Maxwell, Todd Schaefer, and Karen Mitchell. We make up the executive committee. Our board members at large include Gretchen Dixon, Jim Jarvis, Tom Miller, Fred Meiser, and Steve Schultz. Our resident representative, Natasha Bouillon's term ended in September, and second-year resident Katie Kirk joined us. It has been an honor and a privilege to work with these leaders in family medicine. They have been working hard to make your organization a successful one. So what have we accomplished this year? It's no small list. First, we have continued excellence in training new program directors. The National Institute of Program Director Development, or NIPID, is in its 22nd season. This year we will add 60 persons to our roll of NIPID graduates, bringing the total to well over 900 highly trained individuals. We have also continued our excellence with the Residency Performance Index, or RPI. This tool allows program directors to compare themselves to national standards, thus helping them improve the quality of their organizations and the graduates they produce. This year, we had more than 130 organizations submit their data. As a bonus, the AFMRD is giving every program who completed the RPI a copy of RPS's new updated Criteria for Excellence. After 3 years of development, the Residency Curriculum Resource subscription phase was launched last year at this meeting. It has enjoyed great success. RCR currently includes over 100 topics with peer-reviewed facilitator guides, presentations, and quizzes, which can easily be used by your faculty. Over the past year, nearly 200 institutions purchased and implemented this very important tool. Karen Mitchell has done a great job as our liaison to this important project, evaluating whether changing the length of a residency significantly impacts quality. We will not have conclusive data for a number of years, but asking the right questions of program directors during the study will give us the clearest picture. This year was another successful year at the Family Medicine Congressional Conference. As part of our organization's commitment to advocacy, we sponsored 10 residents to attend, learn about advocacy, and meet their representatives. These residents bring enthusiasm to this event and subsequently to their residency programs. The AFMRD has also been involved in advocacy through AFMAC, the Academic Family Medicine Advocacy Committee, and continues to fund our advocacy representative in D.C., Hope Wittenberg. Joe Gravel serves as our AFMAC liaison. So what are some of the other things our association accomplished this year? We advocated on behalf of our members' interest in several cases. We sent a letter to the ACGME to advocate for a change in the timing of the release of faculty and resident survey data, and they listened. This year, we should get data in a much more timely manner. We sent a letter to U.S. News & World Report protesting their publication of Doximity's faulty ranking of residency programs. This led to further useful discussion about the unique nature of family medicine residencies and targeted discussions with students about the dangers of ranking systems. Representatives of the AFMRD were voices in a number of summits examining important issues for family medicine. The GME Summit looked at new ways to fund residencies fairly, a wellness summit which led to the creation of a new task force, and an ACGME Duty Hours Summit, which should help with the reform that needs to occur in this area. We also brought to light a number of important issues through articles in the Annals of Family Medicine. Your board leadership represents you at the Council of Academic Family Medicine, or CAFM, the Family Medicine Working Party, and the Residency Education Symposium Planning Committee. We also have great liaisons listed above. These folks represent you with OPTA, the Center for History, the Annals of Family Medicine, CIRA, and the AAFP Commission on Education. Another benefit we will have by the end of this year was made possible through a partnership between the AFMRD and the ABFM. A graduate survey, which meets the ACGME requirements, will be administered by the American Board of Family Medicine as part of the MOC process. The ABFM will survey your graduates when they are 3 years out and will provide you with the data. We have convened a task force to help format and present the data in a way that will help program directors. This task force will also be reviewing aggregate data and making suggestions for revisions to the survey. As always, you are free to do any additional survey of your graduates, but this will allow you to see comparative data from around the country. A special thanks to Karen Mitchell and Lisa Maxwell for their great work on this project. Because of single accreditation, your board saw a need to assist our osteopathic colleagues in their conversion from the AOA world to the ACGME one. To this end, Jim Jarvis, Judy Powles, William Galanders, and Zach Watterson created a special program for DO program directors looking to convert their programs. This course, Accreditation Navigation, focuses on the topics most likely to trip up a program during the ACGME accreditation process. Our first rendition of this course was extremely well received, and we expect continued interest in this program. A downstream effect of this has been the forging of a strong partnership between the ACOFP and the AFMRD. The ACOFP felt so strongly about the importance of AFMRD membership for their program directors that they offered to pay the membership fee for those wishing to join. As this country is in need of more and more family physicians, we cannot afford to lose programs to this process. We hope through efforts such as Accreditation Navigation and others, all DO programs will have a successful transition to the ACGME accreditation. In partnership with the Family Medicine for America's Health Board and the rest of the CAFM organizations, the AFMRD assisted in the creation of the Entrustable Professional Activities for a Family Physician. These EPAs are broad categories of activities that define the essential professional work of the discipline. As such, EPAs define both the expectations for the education of family physicians and the expectations for the type of care that the discipline of family medicine will provide to the public. CAFM hopes that the discipline will use the EPAs to help standardize some of our processes and evaluations. To that end, the AFMRD has created an EPA task force. Headed by Roger Garvin, this task force listed before you will create tools and methods for use of the EPAs and evaluate their implementation across family medicine training. These tools will be created to assist program directors in creating this country's primary care workforce. One of the greatest strengths of this organization is the sharing of ideas. Our email discussion forum, commonly called the Listserv, has long been one of the most popular ways our changing group of program directors discuss the ins and outs of this very difficult and complicated job. Last fall, the AFMRD invested in an online platform to enhance and expand the discussion capabilities as well as other member-only benefits. The result is a new and improved website, a better organized toolbox, and opportunities to store, search, and share information and ideas. The task of organizing and optimizing this tool will fall to the Outreach Committee. Stop by the AFMRD exhibit table to learn more about how you can make the most of these new capabilities. I can't wait to see what we can do with this. This has been a great year to be a member of AFMRD, and I am grateful for the opportunity to have served as your president. A lot is changing in the healthcare world, but with the people in this room, I am confident that we will provide a better, more stable primary care environment for our children. So what does the future hold? I don't know for sure, but I do know it is bright. Bright for family medicine and bright for AFMRD. Thank you.